Hello and welcome to Dandy Soap Herb Shop. I'm Elizabeth and we are talking about inflammatory breast cancer along with invasive ductal carcinoma. I was diagnosed June the 1st of 2026 and I am estrogen and progesterone positive, HER2 negative. Um, I have stage 3. That means that it's rather large tumor and it is in my lymph node. I have a catheter port already in place, and today is 1 week since my first chemotherapy in my first cycle of chemotherapy. So, a week later, they have you to come in and take fluids. So, what I'm going to cover with you today is some of the things that's going to happen to you after you take your first chemotherapy treatment, what you can expect, and what you need to be aware of so that you can talk to your doctor, your oncologist, and you'll have that information and you'll feel more comfortable and understand that some things that's happening to you, and that way it will take away some of your anxiety and fear, give yourself a sense of normalcy and understanding that's going to be your new norm and what you can anticipate. So I hope that this will give you comfort, educate you, and help you along your journey as you follow me in mine. Um, Additionally, if you're assisting someone who has inflammatory breast cancer, a loved one that you're taking care of, or you have a friend, even yourself, this will be information that you will have and you can share as well. So bear with me as we get started on what's it been like these past days and what was today's adventure about. So I want to start out with what happened to me after I took my chemotherapy approximately 7 days ago. My first day after chemotherapy, I woke up and I noticed that my breast was in pain. And at that moment, my pain was pretty intense, but out of 5. And I thought maybe it will wear off, but it kept increasing and getting more intense. And the pain that I was experiencing in my breast was not like the pain I'd been experiencing prior to chemo. The pain I'd been experiencing prior to chemo was aching and annoying pain, something cold and sharp going right into the end of my breast, uh, just just stabbing, and it just would just grab you and grab you and grab you, and it would contract and contract and contract, and that's what was going on, and I kept feeling that pain. Also, the site area from where the lymph node biopsy had been taken, along with a little bit of irritation from the breast biopsies. So those, but more of where the lymph node entry was, not the actual lymph node, but the entry point where they went in. And as I investigated it more, it seemed more intense where the actual breast biopsies were taken. So it may have been the fact that at that time prior to chemotherapy, one, the cancer is still trying to grow and it's multiplying and it's aggressive. Also, your body still wants to heal. So it's going to try to rebuild the cells there. And with cancer breaking things down, you have this pain because your body is trying to repair and then your cancer is trying to destroy, and they're at a tug of war and they're really battling it out. So you will feel pain. And of course, the cancer's trying to grow, so it's destroying the good cells, and that causes pain because it's breaking through and it's trying to do things that, the body's trying to resist it, but the cancer's winning. So that's just a kind of analogy of what's going on in there. Okay, so that very next morning, I woke up and I knew I had to drive back down to the clinic to get the growth shot. And the growth injection is to put um, that particular injection creates new white blood cells, and so it directly affects the bone marrow and alerts it to start producing more white blood cells. And that's, your good blood cells, your infection fighting blood cells. And they are rapidly working and working. So you have to go get that shot, and you can only have it, it's a time set for it. That shot must take place approximately 24 hours after your chemotherapy. So it's very important that you're there when they tell you to be, and that you are prepared so that they can timely get that injection in you. Now, there was a time when they allowed a patch, and there are still times when they will approve a patch where you can do that at home. There are some situations where they will teach a loved one of yours to inject you with that growth serum at an approximate hour, approximately 24 hours after your first cycle of chemotherapy. And that only occurs with certain chemotherapy treatments. I am doing the one that they have me on is the very intense one called the Red Devil. You'll become familiar with that word and that term, and I will give you the specific um, chemotherapy names of my treatment. So my particular chemotherapy, I'll get it. They write it down for you, and I have to look at it to even say it. So dexarubicin sign or dexarubicin, which is adriamycin. Adriamycin is the name brand, and the generic name or the biological name of that chemical is doxorubicin. And that, along with Cytoxin, and you will hear these two talked about immensely when it comes to chemotherapy. That is the two that they run through my IV. Now, the dexarubicin is the Red Devil, and then the Cytoxin comes after that. The that I will take that for 4 cycles. Now, a treatment, a single treatment, is considered a cycle because it is so strong and intense that they will allow uh, 2 to 3 weeks between treatments so your body can recuperate, um, and also to lessen the side effects and any potential harm that it may cause your other vital organs, keeping toxicity down, allowing your white blood cells to be able to still combat um, regular bacteria and infections and stuff, because you don't want to exposure to other people and things, and I'll go over that later. So with those two going in, they also follow that with like some fluids. But before then, they usually give you a steroid, which mine is dexamycin. Excuse me. Uh, I'm gonna have to read it too. Uh, yeah, dexamycin um, is a steroid, and they will give that to you for nausea and energy. It kind of to help combat the fatigue. Well, I'm not crazy about taking any kind of steroid or anything, and these chemicals are going in my body, so I am resistant to a lot of this stuff, and so I try to use the minimal amount that I have to. But I understand it more, and the more you do this, that you'll become more educated about what they're giving you and why they're giving it to you. Maybe you won't be as resistant as I am, but to me, the less that I have to put in my body to achieve the goal, that is what I'm going to be. That's going to be primary in my mind. I don't care. It's always been me. I'm just stubborn that way. I will follow the rules. I will follow the regiment. But I am an individual. If you explain things to me instead of just telling me I'm going to do da 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 and then don't tell me why, that's where you get flack from me. That's where I become, I don't know, non-agreeable. And I don't, I am not, I am a person of intellect. Treat me like an intellectual. get me on your side and be proactive in my care. I care about how I'm being treated. I care about what's going into my body, and I care about the treatment plan. So educate me. I feel that that's their job to educate me. I should not have to come home and Google it or watch numerous videos, which is what I have done in order to educate myself on what the hell this shit is. And that's straight up. That's exactly what I've been doing. So now that I'm getting a little more information, a little more knowledge, when I go to see them, I let them know what I know. And then they can fill me in. So I think they now see that I'm a person that they need to tell me and explain to me and educate me about what it is they're doing, why they're doing it, and what's it used for, so that I have a firm understanding. And then you'll get no argument from me. You can be a salesman, and I'm fine with that because I'm a salesman too. So just educate me and get me on your side. Don't assume that I'm some dumb hick with some kind of southern drawl and that I don't have a mind, because I'm very intelligent and I'm just as smart as the next guy. So don't undermine me. I know you're intelligent. I know you got a degree. That's why I'm coming to you. However, if I could do it myself, I wouldn't come to you. So that is why we have to work together as a team. And I think it's real important that your medical team and you be on the same page, on the same team, and working together. It's going to be more effective in your treatment and the cure. So I just don't like it when they don't tell me things and they make assumptions. And that I'm supposed to be okay with that. I'm just not okay with that. So moving on, I am on this strong chemotherapy and I felt that pain. I mean, the pain that I was experiencing though was like an open wound that the oxygen is hitting it. So it's like on fire and burning, and the pain was very, very intense. I drove myself back down there to take the growth shot, and I had expressed this to the nurse. She didn't read a lot into it. She didn't really seem to be concerned or that it was a big deal, and just felt that would be okay. And I just laid with it, right? I thought, okay, let me just have this wandering around my head because no one's giving me an answer. I was looking to her to give me an answer, expecting that she might have heard that from another patient and be able to explain it away or give me some resolve, but she gave me nothing more than what I had when I went there. Well, I went ahead and I took the growth serum shot. They took my vitals. She expressed that, my blood pressure was down. That would explain the dizziness and the kind of the woozy. And my energy was still high because they had pumped all that into me the day before, and all those steroids and the fluids, everything was working together. So I was still, very energetic. I made my video and talked to you guys. Well, I went on home, and so I had energy that day. I did video that day. I was hungry, so I played into my hunger, and I just stayed hydrated. Made sure I kept hydrating, kept hydrating. Now you have to remember, your body is feeling like a warm ember is burning. That's the way I felt, like a warm ember is burning. Like I almost felt like a fire breather, like my nose and my mouth and everything. I could feel like fire. Um, so that was just what the best analogy or the best way I can describe it. In addition to that, I'm trying to subdue my pain. So I noticed that my Tylenol regimen, I had to, it took hours that pain lingered on for hours. And finally, 6 capsules in the Tylenol before anything was happening and turning around with my pain. Now, along about that time, my energy was starting to deplete. So we're on this was the day after. The next day, I did pretty good. My energy was up, but I noticed that it didn't last long like I would could put real easy. And I did feel, tired. I was trying to keep my fluids up, keep eating, and not, and I felt a little nausea in my belly, but I was keeping weight in my belly. So the first thing I turned to was like instant oatmeal, and I wanted things that made me feel full for a long period of time. I wanted a pintos, so I ended up eating pintos uh, for lunch and I think breakfast. So onions. I was like, it was making me feel better, and that weight in my belly. So they'll get you through the nausea too. And so the next day, though, on two, day three, so if I count my infusion date and I count the day after, let's just say that was day one and day two. But on that day two, the second day after, when my energy started depleting and I'm still fighting off the nausea, everything's going fine. But on that third day, and the fourth day, and the fifth day, my energy, I was so fatigued, guys. It is the overwhelmingest chronic fatigue. And my mouth, like my motor skills were not keeping up with, like my mouth had trouble forming letters. So I sounded like you could half understand me because I was like a drunk. I could get one eye open and the other one I would struggle trying to get it open because of the fatigue. It was this, and I was so fatigued. I mean, I'm talking mopping the floor. Um, your fatigue is great, and you will have moments when you're you're real fatigued and you just want to lay back and close your eyes. And if you can go to sleep, go to sleep. That's going to be the best rescue for you, is to rest. With the discomfort of my breast, and I'd had biopsies on this breast and a catheter, I'm not able to sleep on a side, and I'm used to sleeping on a side. If I sleep on my back, you know, there comes a time when you've done that so much, your body really does want to lie down. But when I would lie down, I just feel all that hotness up here at my face, my mouth, the fire breathing, dragging, just like hot, like a hot ember. And so, of course, but you still want to be under a blanket. Another thing I noticed is I had these shakes. Like I'd have a cold chill come over me and have the shakes almost like you're running a fever, but I kept an eye on my temperature. So that's real important. Monitor your body temperature, like kind of be consistent about it. Every little while, maybe every 2 or 3 hours, just check your body temperature and make sure you're not running a fever. If you run hotter than 100.4, if it goes over that mark, you need to let them know immediately. So if your body temperature hits 100.4, contact them immediately, your oncologist and whoever they have, their 24-hour phone line. They need to know that because that means there's potentially a bacteria or an infection that's set in, and they got to get to you immediately. So monitor your body temperature. Another reason why you don't want to have to take pain medicine uh, like Tylenol, because it has a fever reducer. So if you are dealing with pain, you need to make your oncologist aware of that so that they can issue you something for pain that is not a fever reducer, because they really need you to be able to monitor your body temperature. So far, I have resisted having taken anything outside of the Tylenol, and I'm careful about only taking the Tylenol if I absolutely must have it. And that particular time, I needed it. The next day, I didn't have any pain. I just had it that day after the chemo, and everything went. But talking of the fourth day, I had pain again. Or excuse me, I beg your pardon. The fifth day, I had pain again. So once again, I felt the need that I was going to have to take some Tylenol because it was that type of pain, but it wasn't as intense. And because I'd had that happen, I was fearing it. So I took like one Tylenol just to see if I could just get whatever ache I was having to stop. Aching is pretty common. I know that sounds crazy, but yeah, your breast can ache from that pain. And so it was more of these little cacarious little spiky pains, little bitey pains that would just come and go and come and go. And they really were more like a ache type thing, not an intense bad pain. Um, so that was my third, fourth, and fifth day. My fatigue was so granular that, like I said, my mouth didn't want to form letters. Um, being able to stay uh, my eyes open. I could hear everything and I would respond. So I was conscious. It's just that the fatigue was so chronic that my body couldn't, like be like it is right now, up, alert, I'm smiling, I got everything going. Um, I'd also had to have assistance to get me to the bathroom and get me out of the bathroom because my fatigue was so I was pulled down so much by the fatigue that trusting myself to make it there without falling and get back. Um, well, it wasn't a chance you need to take. If you've got somebody who can help you, then definitely take advantage of the help. But I was very chronically tired. And the chronic fatigue that you're feeling, like with the way my body was reacting, you would have thought that I was so drunk, like I had majorly overdone it drinking alcohol, and you couldn't understand the words that were coming out of my mouth. I'm just like, my head's, my body's slumped over, and I wasn't, I wasn't much help to anything except just a pile of body to sit there. So these are some things that you can expect on the chronic fatigue. As but after day 5, that fifth day, and that's because I'm counting from the day counting the day of chemo and out. So technically the fourth day. So my third, fourth, and fifth day of counting the day of my chemotherapy, the day after, the the next day, and then on up to 5 days after it was chronic fatigue. Well, because that chronic fatigue had started coming and going from the fifth and sixth day. And that fifth and sixth day, I was afraid that, I would be hit with that chronic fatigue and then it would pass. And then I'd be like I am right now with energy and felt good. Or, with energy, I mean, as far as like trying to get anything done, forget about it. You're not going to be able to do it. It's just not doable. And so I decided on the night of the 6th that I was definitely going to go do the fluids. Now, a week in your cycle, like I told you, they break it out. So you'll have your chemotherapy, and then generally 8 days later or a week later, you will take fluids. So approximately 1 week from your chemo date. And I implore you to definitely get the fluids because after getting the fluids, I felt like myself again. I was spunky and extrovert, and you see all my motors are running. I feel good, and I had energy, and I mean, it was just wonderful. It was amazing because it replenishes you. It just restores you. When I had asked my husband to take me because up until that point, I was planning on taking myself. But with the fatigue coming and going at that point from days 5 and 6, because 3 and 4 into the fifth, I'm not kidding, I was that chronically fatigued. On that fifth day, it had passed, and I felt like, okay, it's going to be all right. But the sixth day, I'm getting that fatigue and just, and then it would pass. And so my brain's thinking, okay, I need to be prepared because that's a long drive. I shouldn't do it by myself. I need to make sure I got somebody with me. And so I asked him to take me. And I'm glad I did because getting there, I was really fatigued. And, I had managed to get me a shower, um, get my clothes on, of course, all that good stuff. But I ate me a piece of pancake. I ate a single pancake, no syrup or nothing, just took it with me. And I had my drink. Well, um, he drove me, and it takes 1 hour for them to put the fluids in you. So it's fluids like you would get at a hospital through an IV, but they hook it in here and they give you your fluid, and it takes 1 hour. And during that time, why I really want to express this to you, um, when I was going to go and I was going to do it on my own, I was really really fatigued. Like, I'm don't trust that I could have got myself down there and done it safely. Maybe I would have got down there and then getting the fluids. Okay, I was fine, ready to go, no problem. Bear in mind that was my first chemotherapy treatment. Things like that will become worse the more chemo you have, and generally the symptoms that I was expressing generally doesn't happen until you've had more chemotherapy treatments. It's according to what they're telling me, that was uncommon. I mean, it's not rare, but most of the time the chronic fatigue I'm describing does happen, but you've had numerous chemotherapy treatments. Um, some of the symptoms that I was expressing, they thought that, that was a bit much considering that was just my first time out. And, uh, but I just want to make you aware that sometimes you may be talking to a PA, and you may personally feel like that individual should spend more time in the clinic amongst people who are suffering through the chemotherapy. Um, and she should have some hospital time to experience it beforehand instead of just sitting in an office talking to people who are receiving treatment. Lot of difference. Lot of difference. We can conversate about things all the time. But if you're not in the game and you aren't really there seeing those patients experience what they're feeling, talking to them while they're being treated, and figuring out, okay, this is what's really going on with them. I'm sorry. I just got really irritated with that individual today because they're telling, the things that they're expressing to me is though like mine isn't validated. Does that make sense? And trust me, just don't let the person get to you. I was determined not to let her get to me because I've encountered her before, and so it bothered me that I had to be encountered by her this time and get the same response out of her that I got from her before after I identified a correction with my own medication and my own treatment. So don't get up my ass because I will let you know that I don't agree. Um, I'll try to be professional about it and I will smile the whole time. But I'm going to let you know it's not okay. Nope, not okay. And I will just smile. No, it's not okay. And that is the way I feel about it. Do not treat me like a damn dumbass hick. It ticks me off. My southern drawl does not make me less intelligent. And don't underestimate it. And if anybody's ever watched Andy Griffith, well, there you go. That shows you exactly. Don't underestimate people. Don't assume that they are lack of intelligence because they got a southern drawl and they're nice and they're polite. It's just called good manners and good raising. I digress. Let me digress. As I move forward, so I expressed to them some of the symptoms that I had experienced. The feeling like I was on fire. The uh, the fact that my heart is beating so quick that I can feel my heartbeat. And I don't like that. It's like being in a vibrating chair. And the vibrator just don't cut off. I have felt that ever since I got the chemo treatment. Since got the fluids today, that's actually calmed down. I mean, like dramatically, like it's tolerable. It's not bothering me now. I was vibrating so much that my body was rocking. So I'm telling you, every person is different. But if you are experiencing any of those symptoms, it's pretty much par for the course. It's just trust me. Um, I kept having a slightest headache, like it would just come and go, and it's almost like it was sinus, but it wasn't. It was up here in the face. Well, that can come from the chemo, and it can also come from the growth injection shot. So I elected to take the Claritin antihistamine, or the generic Claritin antihistamine, to also assist with that little dull headache that would come and go. And I was getting out on a regular, and some days more than others. Um, wasn't bad. It was just it's there. It's about the time you need to take something, or it's going to get worse. So that is a side effect too, that you may have just this little mild, I don't know, headache, almost like a sinus headache, and just take the generic of the Claritin antihistamine, and that seemed to have subdued mine a little bit. It's not bothering me so much. And when I came home, I was hungry. I ate a nice lunch, and then I went to sleep. And I mean, I slept the best I have slept through this whole thing since my chemo. I'm talking solid, good old fashioned sleep. And I probably got at least, I don't, I would say, uh, probably 4 or 5 hours, a good long period of time. And I felt great when I woke up. I felt really good. I was hungry again and ready to eat. And I mean, it was just wonderful. Um, some other side effects that I've experienced during that time, other than the chronic fatigue and the racing heart and the ember feeling and things like that, and then the mild little tiny headache. Now, the reason why I shared all that with you is when I went today just to get fluids, there happened to be a wonderful nurse there. And she is puzzled by all these symptoms that I'm talking about and not feeling like that should be right. So she is notating them. And they're able to message and communicate with the actual doctor and the PA, and I guess they take turns on taking patients to talk to them. So they, rather than me taking my injection back there where you generally do it in the pod for your chemo, they actually took me to an examination room so that I could talk to the PA or the doctor. And the PA was the one who did talk to me. Now, I will put in a different video um, the conversation that you can have with your oncologist and or practice excuse me, physician's assistant in oncology, um, and what you might expect to hear in response to what your concerns are. And the reason why I want to put that in a separate video is I want to make sure that I am not overwhelming you with more than you're ready to consume at one time just because it's my case. Your situation may deem something different and it may not even be going in that direction. But to keep it more isolated over what to expect and anticipate 1 week out from your first chemotherapy treatment, that you are taking the same chemotherapy medicines that I'm taking. And just remember the the medications do make up for the effects that you're going to feel and how your body is responding to it. I want to end with this. As an herbalist and a practicing apothecary, I've done this work for over 23 years. I've worked with people and collaborated with them on what their true goal is, what it is their main concern, and what issue it is they want to address when it comes to their personal health, and I'm just the bridge between the person and the plant, or how to the application and or plant, and intervals and how to apply and that kind of thing. So I just bridge the gap. And by collaborating with people, I'm used to working with individuals, and we tweak it and we work with it and we tweak it and we work with it till we figure out what is going to be the best result. Additionally, um, I too had to learn that I don't know everything. I don't. And that sometimes the patient can educate you, and you just need to be quiet and gather the information collectively and be of a higher intelligence by processing it and learning from your client, your patient, because they know better than you do their body, and how things affect them is going to differ from someone else. And that's why it's important to customize their product to fit their need and to cover what their concerns are and what it is that they're trying to accomplish and fix, because you're working together. And remember, they entrusted me to help them with their health, to be proactive in that. So I need to appreciate what it is that that patient or client is telling me, because that's going to help me in my future with other individuals who may actually have the same problem. And now this patient has taught me how I can fix it and what is going to be what worked best for them. So I too, in my past, have had to learn to keep this closed and leave both of these wide open, and have this mind open to envelop and take in what they bring to me. Now, with that being said, because my body is not used to putting foreign stuff in it, not taking anything higher than an aspirin or ibuprofen, and that was on a only if I need it basis. The fact that I have eat healthy, I've lived a healthy lifestyle. I eat good foods, next the most natural that I can, next to raw on others, and I put good herbal supplements in me that I've grounded myself, encapsulated myself, or tinctured myself. I'm taking what I put together with these two hands. So I know what's in it. I know there's no fillers. I know there's no synthetic isolating. I know that it's not standardized. I know that it's the raw herb being grounded and packed, or tinctured or decoctioned. And um, to take someone like me who has that clean base, they have no tolerance built up, to no immunity or no cumulative of anything in their body. And it's a fresh, pure vessel that you're putting a chemotherapy, the strongest kind that can be given to an individual, into that body. They're going to have sensitive responses. They're going to respond quicker than the average Joe. And notice that as a side effect, because you're starting with a clean vessel. You're not talking to an individual who's been taking a pain medication or something for high blood pressure or something for cholesterol. You are talking, or diabetic. You're talking to someone who doesn't take anything to maintain any kind of regularity to their body. And you're putting that harsh, the strongest dose of chemical into their vessel. They're going to respond quicker, and the side effects that they have are going to be very intense, because that's their they don't have no kind of build up or something else that they can blame it on, because a lot of people are used to taking a medication that they can easily blame some of the stuff that I expressed on that medication. See, I didn't have medications, and they're looking at my record and saying, "Well, you're not. So you don't. No, I'm not taking none of this, and I'm not treated for that." So that's why they're like, "Well, maybe we should just listen to what I'm saying. I know my body. I know what's happening to me, And sometimes I think these PAs need to take their tail to the actual hospital and the actual clinics where there are real live people who are being treated for what they're specializing in and see what that patient goes through. Like just stick around there for a little while and observe what these patients are going through. I think they need some more in-house clinicals rather than they're at that nice little air conditioned office and the patient's coming there and they're talking to that patient and the patient's going out and having treatment. So all the shit that that person has gone through and is suffering is done away from that facility for days, and by the time they see you they done suffered through all of it. So you need to keep your mouth like that and listen with these and stop breaking down and psychoanalyzing everything as though they're stupid. I'm telling you, she hit a spot in me today, and I'm making you aware. Do what I did. Just smile. Okay, okay. But you keep in mind what it is. You know. And listen to what she, just let her talk. And eventually something will hit her in the back of the head just out of freaking nowhere before you leave that room. And she will suddenly be agreeable to you. Now imagine that. I guess that's the way the stars are. But I've had to endure that twice with the same individual. And if it keeps happening, I will plain say, either I see my doctor or I see no one. I don't want to deal with her. She stresses me out. I am like repeating myself 3 times. She has taken what I said, misconstruing it, rearranging the words, and then feeding it back to me. Or I tell her something, and then it's almost like it offends her, and she will feed it back to me as though it was her original fault, and she was the first one to say it. I can't stand people like that. I cannot stand that. Give credit where credit's due. Like, oh, that's I hadn't thought about that. That could be. Well, let's see. Maybe are you doing da 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 da? Let's try da 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 da. She's the professional. She's the one with all those years that she put in for medical to get her degree. I know me as an individual in my body as a patient. So when I'm telling you something, I'm looking to you to help me understand and tell me, is that normal? And what can we do to solve the problem or make it better or fix it? Because you're the doctor, I'm the patient. And when that role seems to be interfered with, someone, I can tell when somebody's looking at me and the way they treat me, that they're treating me like a dumb hick. Now I can tell you, I read that, I know that look, and I know the attitude behind the way they talk to me immediately. And it offends me to the utmost. I mean, like Max offends me. But I have to bite it. I have to bite my tongue. I have chewed the side of my jaw just to keep quiet. I'm telling you. Now, I will tell you this, another side effect that has already hit me, which shocked them too. I already have the raw gums and the mouth sores. And that's after one treatment. So they had to issue me a prescription for Magic mouthwash. And guys, it's really called Magic mouthwash. It has lidocaine in it. And so I have swelled up gums that are raw down here. My tongue has bumps broke out on it and it's raw. And then I have a place in the roof of my mouth that is raw. So this rinse will help. uh, the rinse is supposed to help, uh, heal that and make it better and less sensitive. And they do want you to continue to eat. And hopefully I won't get thrush because I brush. Even though that's going on, I still brush my teeth. You can do a saltwater rinse. That's supposed to toughen things up, and that will help also remove anything that's died. Get that off there. but the rinse is supposed to help heal it too. It's medicated and it helps. It's a compound medication. So, um, and it is best to get them to fill that compound because it's about $400 if you have to get your local drugstore to get it or have it formulated and sent to them. So if it's available to you, go to the actual oncologist recommended hospital or facility that will fill that for you, because then you can get it for about $36 versus $400. Just something to bear in mind. So I know that this video has been long-winded. I've had complaints. I've thrown a fit, and I've said this and that and other. So do forgive me and lend me your heart and understanding for what I'm going through. But I just want to give it to you raw, exactly what said, what I said, how I reacted, what I'm experiencing, so that it can somehow help you. And once again, leave comments, contact me, email or phone. You can find that information at dandelionsoap.com. And that just keeps me safe here on the net. And that way I know if you watch the video, you got the info. I'll also put it in the description box down below. But leave your comments, and I am here for you. I will answer your questions, be glad to chat with you, and assist you in any way I can or find out additional information. So thank you so much for watching the video. Make sure you share it out to someone you think will benefit from it, especially if they are dealing with uh, infl- inflammation breast cancer, inflammatory breast cancer, um, invasive invasive ductal carcinoma, and that they may be on the same level as me. They may be estrogen and progesterone positive with HER2 negative, and that will help too. But this video is, IBC, 1 week since chemotherapy and day of fluids, round of fluids, and what to expect from during the 1 week period of time. Now, 1 week from today, I will go back for my next chemotherapy treatment. So supposedly this is going to be my week of rest, recuperation, and just all over have energy and feel better. And then, of course, I'll have to start back over again and go through the whole thing again. My hair has stayed intact thus far. It hasn't gotten loose, but it has been a week. They usually say uh, at the 2 week mark, and then sometimes they say 3 weeks. So I might actually be able to hang on to my hair until I have my second chemo treatment. And but I'm going to cut it down and cut it back because it's past its trimming and regular housekeeping I generally do, because I was going to the doctor, so didn't get that hair care done. And so I'm going to probably trim it down just so it's less to deal with when it does begin to come out. It'll be less shocking too, and help me to adjust quicker. And it's just too long and unmanageable at this point. So I thank you all for joining me. This is Elizabeth, and until the next information and fussing video, I'll be talking to you. Take care and keep up the prayers, because we're all going to see each other on the other side of this and get through it. And until then, take care of you. And if you need me, I'm here for you. Just let me know.